The lymphatic system is a system of channels that contain one-way valves, and these one-way valves are what help push that fluid back into our circulation. So the one-way valves depend on our muscle movement, so the pumping of our muscles to return that fluid back into circulation. Their role is really to pick up the extra fluid and proteins that the veins aren't able to carry because of the size of them. Within these channels, the lymph nodes are contained, and so they act as filters as the fluid is coming through. The lymph nodes are like little sponges that collect any of the bacteria, viruses, or in our case, cancer cells that need to be trapped and removed through the immune system. So the lymph nodes exist in our body in clusters, and the cluster that's most important when we think about breast cancer are the clusters that exist in the armpit or in the axilla. So depending on the size of each person, we expect to see between 20 and 40 in each armpit. So what is lymphedema? Lymphedema is when we see fluid start to back up into the tissues in the body as a result of injury that's occurred to the lymphatic system. So in our case, when we think about breast cancer-related lymphedema, we're thinking about the injury that occurs because of the surgeries, so the removing of the lymph nodes that happen during sampling of those lymph nodes, as well as radiation that happens as part of treatment. So it's important to remember when we think about what caused lymphedema that it's really the treatment that's required to take care and get rid of the cancer. So there are some risk factors, though, that then increase the risk. And so when we think about that, there are three main risk factors. BMI, or your overall body weight. So we're thinking about obesity or being overweight because there's more of you. There are more cells and more fluid that your lymphatic system has to move. So if that lymphatic system has already been damaged because of the surgery or radiation, then we're going to see that the body has a harder time moving that extra fluid around. The next is related to injury. So injury, if you think about an ankle sprain, if you turn your ankle and the ankle swells, part of our body's healing mechanism is to bring fluid to the area. And so in that process, the body then has to be asked to move that fluid back out of the area. So if we see an injury in the arm, and that extra fluid comes to the area, if that lymphatic system is damaged, it may not be able to then get all of that remaining fluid back out of the arm, and as a result, we can see swelling that remains. The final is infection. So when we think about infection, the same is true. If you've ever had an infection or a little bug bite that got swollen and red around the area, again, the body brings extra fluid in, and our body may or may not, when the lymphatic system's been damaged, be able to move that fluid back out of the area. The final component to think about for injuries is burns. So for sunburns, particularly in the summer, it's important to remember to put a little bit more sunscreen on consistently than you might have otherwise bothered, because a burn counts just the same as any other injury, and so that the body will have potentially a difficult time moving that fluid that then comes in to heal the sunburn. So about 20% of patients will develop breast cancer-related lymphedema, which means 80% will not go on to develop lymphedema. However, treatment is much more manageable if it is detected in the early stage of development. So it's very important to watch for those early signs and symptoms. So what we're watching for is in the affected arm, which means in the side where the lymph nodes were removed. If you are a patient who's had bilateral breast cancer, that could potentially mean both sides are at risk, and we want to watch for these symptoms to occur in either arm. So what we're watching for is any heaviness, achiness, fullness that occurs. And you may or may not at this very early stage see any visible swelling at all. It's really just a sense that patients report. Then as it begins to progress, you may notice things like your rings feel a little bit tighter, your watch feels a little snugger, an arm sleeve at the top may feel a little tighter. And so this is a sign that now we've crossed into having some visible swelling. So any of these symptoms, we would want that reported right away to your physical therapist so that we can, again, manage that very early and help prevent the progression of the lymphedema. So if you notice these early signs or symptoms, your physical therapist will evaluate you for lymphedema, and we do that by taking measurements to compare each arm to the other to determine if there is fluid that is lingering in that arm. There are many ways that we treat lymphedema, and the primary components of that consist of exercise as well as compression. That may be a compression sleeve or bandaging. There are multiple options. And then your physical therapist will also work to improve the mobility of your arm. And that's important because when we talked earlier on about the one-way valves in the lymphatic system, it's really important that that arm, it can move freely so that the muscles can then pump that fluid out and assist the return of the lymphatic system. We also use manual lymph drainage, or MLD, to help manually move the fluid that is trapped in the arm as well. And again, as we talked about earlier, weight management is an important component of treatment for lymphedema. So I also want to cover some common myths that exist related to lymphedema. So the first of those has to do with getting your blood pressure taken on the affected side. Again, that's the side where the lymph nodes were removed during your surgery. So the research shows that it does not increase your risk for lymphedema. So if you do have a, quote, good arm, so a side that hasn't had any lymph nodes removed, you can use it on the other side. But it's important to remember that if your blood pressure does get taken on the wrong side, that it's okay, and research shows that this does not increase your risk. The same is true for needle sticks, so blood draws out of that side. So getting blood taken from the side where the lymph nodes were removed is perfectly safe, and research does not support that increases your risk. There is a difference, however, that's important to remember between having blood taken out and having fluid put in. So remember, if you are having an IV put in, so for hydration purposes, for example, so fluid that's going into the body, that lymphatic system on the side will have to move that fluid, and so we would recommend that that's not put in on the affected side. However, blood can be taken out safely from that side. One of the other risks has to do with airplane travel. So long-haul flights in particular, there's a concern that we may see increased swelling related there. From the research, what we really know is the most important components of flight, particularly long-haul flights for patients, are that they stay well hydrated, which helps ensure that lymphatic fluid stays thin rather than becoming sort of a thick, goopy consistency, which is then harder for the lymphatic system to move, as well as not staying in your seat for your full 8-hour flight. So it's important that you're getting up and moving, again, like we've talked about the muscle pump. So if you're sitting in your seat the whole time with your arms bent, that fluid can't effectively move out of your arm because of the kink at the elbow. So if you stay well hydrated, you're going to have to get up to go to the bathroom, and that helps eliminate both of those issues. The final myth that I want to talk about is lifting weights. So any amount of weight. You may have heard things about not lifting a purse or a child. None of those are true. So research supports particularly resistance training, so weightlifting for patients, as a way to help reduce lymphedema for patients who have it, to make it more manageable, and as well as preventing the risk of developing lymphedema as well. What we do know is we do want to be mindful of injury. So what that means is we want to safely progress exercise. So we want to start at a place where your physical therapist guides you and then slowly increases that weight that you're lifting at a safe pace to prevent any injuries. But we know that there's no upper limit to how much weight a patient can lift. I like to tell patients that, can I run or can I compete in a triathlon? I absolutely can. I can run, I can bike, I can swim. Could I compete in that triathlon tomorrow? No, I am not trained to do that. And the same is true. So if you haven't been lifting any weight, we don't want you going straight to lifting 50-pound dumbbells. But if that's your goal, we can absolutely get you there. We just need to slowly and safely progress you so that we don't have any injuries.